Going Cade More with More Muscle. Today we're going to be going over nutritional assessment, and we're going to be talking about some consequences of being overweight. So guys, you want to monitor your family's nutritional habits. You want to record what you're eating. You want to see if you're lacking any fruits, vegetables or whatever you're lacking. The next thing is, even someone that has a normal BMI can be malnourished. Guys, BMI is body mass index, and it's how they measure if you're in a good weight or in a bad weight. Bad nutritional symptoms include dry or brittle hair, or skin that has like dry patches, poor wound healing or sores. When you have poor wound healing, that means your body doesn't have enough nutrition to heal itself. Lack of subcutaneous fat or muscle wasting. Guys, a little bit of fat is very necessary, and a small amount of fat is good for you. And if someone doesn't have any fat, that could be a lack of nutrition. Irregular cardiovascular movements, enlarged spleen or liver, and general weakness or impaired coordination. A healthy BMI is about 18.5 to 24.9. For example, guys, I weigh about 180 pounds. I'm about 6'1", and my BMI is around 23%, more or less. Being underweight is about 18.5 or under. Overweight is about 25 to 29.9, and obesity is over 30. Guys, this does not account for large amounts of muscle. So say, for example, someone like The Rock or some, person that has a ton of muscle, they might weigh a lot, but that doesn't necessarily mean they're out of shape. It's because they have large amounts of muscle. So you gotta, this isn't 100% accurate, but it is pretty accurate. Guys, fluid intake should be around 2 to 3 liters per day. The average output, so urination, should be around 1,750 milliliters to about 3 liters per day. Albumin levels should be around 3.5 to 5. And this can, if it's too low or too high, this can indicate malnutrition or certain problem. And then prealbumin levels should be around 15 to 36. Less than 10.7 indicates a severe nutritional deficiency. So guys, if you are worried about having a nutritional deficiency, you can get your blood work done. You can get it for albumin and prealbumin, and it can tell you what levels you're at. It is estimated that about 68.5% of the American adults are obese or overweight. Guys, 68.5%. Guys, that's like saying 1/4 is in good shape. That's sad, really sad. And I don't, a lot of our habits are, like eating oils, going out to eat, eating added sugars, eating processed flours. It's a normal thing for Americans. But those foods have lots of calories and not a whole lot of nutrition. And it's a big thing in our diet. And when you eliminate that, you can get high nutritional foods and low calorie foods, and you can, get in that normal weight. But guys, 68.5% of American adults are obese or overweight. That's insane. That's sad. Being obese indicates the risk of an increased risk for heart disease, stroke, and the American Heart Association estimates about 100,000 people's death come from obesity each day, from each year, attributed to obesity. So 112,000 deaths are unnecessary that come from obesity, from heart disease each year. Obesity increases the risk of high blood pressure. It can increase your LDL cholesterol, which is the bad cholesterol, and lower your levels of HDL, which is the good cholesterol. Guys, good HDL basically takes the bad fat and excretes it. So say, for example, nuts, avocados, those are all really good forms of HDL. And it's good, healthy fat that will help you lower your bad LDL levels. And the LDL cholesterol, guys, that's bad. It can come from animal products and whatnot. It also increases your risk for a stroke, diabetes, cancer, liver disease, kidney disease, sleep apnea, gallbladder disease. So guys, I'm not trying to shame anyone. That's not what I'm trying to do, but I want to be a realist with you guys. And when you're overweight, you're at risk for everything. Now, I work in the hospital. I've had to see, someone with type 2 diabetes, guys, it's terrible. They have to get insulin shots every day. They have to measure their blood sugar every meal. Like, it's terrible. Having diabetes, type 2 diabetes, is something that takes up a lot of time. Insulin is it costs money. That's an extra expense. And so just eating healthy, guys, you can stay away from diabetes. You can stay away from, high blood pressure. You can stay away from so many unwanted, unnecessary diseases if you can just eat healthy and you can keep your weight in a good level. And guys, that is controllable. Don't think that it's uncontrollable, because it is controllable. If you work out a lot, if you eat healthy, you can definitely impact your weight. Okay, guys, some risk factors include genetic predisposition. Guys, there are some people that can genetically put on fat easier. Hormones is another thing. If you're not sleeping good, your hormones can get messed up. Behavior factors such as sedentary lifestyles and diet choices. I want to focus on that because that's a controllable. You can, if you're sedentary, you can get up, you can work out. If you're eating a bad diet, you have the choice to eat healthy. Guys, this can cause depression, low self-esteem, no desire to exercise. And a lot of people that are overweight don't want to go to the gym because they feel like they'll be shamed. So if you're dealing with someone that's overweight, you want to make sure you test their cardiovascular output, make sure their heart's working good. You want to check their diabetes. You want to see if they have a fatty liver. You want to see if they have thyroid disorders. You want to check their total cholesterol, their triglycerides, and you want to check their fasting blood glucose, because all those things are at risk. You want to try eating healthy, exercise, and sleeping good. There are some medications that can help you lose weight, but I think it's much better to try and eat healthy before you try these medications. There's Oralstat that prevents the digestion of fats. There's lorcaserin, and that stimulates the hypothalamus in the brain to stop appetite. And then there's phentermine, topiramate, and that suppresses appetite and includes a feeling of satiety. It's like feeling full. Guys, the next thing is, if you are overweight, you have a risk of dying prematurely. For example, being obese, around 30 to 34.9% BMI. For example, that's about 255 pounds for a 6-foot male. That can decrease your risk from about 2 to 4 years. So if you're that obesity, if you're 30 to 34.9%, you're probably losing about 2 to 4 years of your life, sadly. Now, say, for example, if you have a BMI of 40 to 50, which, for example, would be a 6-foot, 375-pound individual, your life expectancy is reduced about 8 to 10 years. So, guys, being in a healthy BMI is really important. And some risk factors for inadequate nutrition include diseases such as hypertension, HIV or AIDS, preventative measures like a surgery or certain medications, lactose intolerance. Guys, for example, certain surgeries, like a colon surgery, the colon digests nutrients, and or like the bypass surgery, where they kind of cut out part of your digestive, colon. That can cause nutritional deficiencies because your body can't digest those minerals, those vitamins, those nutrients. Lactose intolerance, guys, you won't be able to get certain nutrition. Osteoporosis and a certain age can increase your risk for inadequate nutrition. Psychological factors include mental illnesses. If you're, low in nutrition, that can cause a mental illness. It can cause excessive stress. It can cause negative self-concept. And the use of comfort, unhealthy foods can also can also be a psychological factor of being overweight. There's also some problems such as a socioeconomic factor, including poverty. So if if you don't have a lot of money, you can't really spend a lot of money on nutrition. So it's important to make good money and pay for healthy foods. Get yourself a good job. And alcohol and other substance use disorders, or fad diets, or special food preferences such as cultural or ethnic or religious foods. Choosing foods that can cause you unhealthy problems, right? Examples include using diuretics. So diuretics can cause a nutritional deficiency. Not enough vitamin D intake can cause a nutritional deficiency. And starvation diets are all, can cause malnutrition. You want to prevent anorexia. You want to plan and schedule meal times, and you want to plan out your foods. And one thing you can do is eat healthy whole foods because they're low in calories, and they're high in nutrition. You want to make sure you get outside, get in the sun, and you want to sleep good. So guys, if you want, I have a program on how to eat healthy. It is on my page. It will be the first video you see if you click on my page if you're on a computer. So anyways, guys, thanks for watching. Subscribe.